The new Kosser Children's Medical Center at Brownsboro will not be a hospital. There won't be beds to provide overnight stays. But in the event your child needs more intensive emergency or surgical care, the hospital is just a high-tech transport away.
Courtney Limberg is the princess of her family. She is adored by her twin 7-year-old brothers.
Courtney's our 2-year-old daughter. She has special needs. She's medically fragile. We visit Kosser Children's quite a bit with Courtney's neurological issues as well as a feeding tube. She was born 2 months early and was diagnosed fairly early on that she had some neurological struggles, and we learned more probably when she was about 6 months old. Was diagnosed officially with cerebral palsy. And we know that she's cortically blind as well. She hears very well, but we don't think she can see much besides lights. So we've worked with her quite a bit since she was diagnosed the last couple of years to try to stimulate her in several ways and several therapies.
There are times Courtney has to be taken to the emergency room.
Oh, it's always gut-wrenching and emotional to have to take your child down to the ER. Probably one of the most painful things you can do because although they're necessary, you see so many kids that are suffering down there, and to take your daughter into that environment where, although you know she's going to feel better when it's all said and done, to see what goes on and to see other kids is really difficult, very difficult. But we're glad that we have those services available to us, because without it we would really be in a tough position.
It is our community's fortune to have Kosser Children's Hospital with a full-service emergency department and trauma services. It's a busy place.
Very busy in the last several months. In the last several months, we've hit the 5,000 mark each month. That's since about September. We live in Louisville, so you never know when it's based on what the weather's going to be like today versus tomorrow. So we see a lot of respiratory kids, asthmas, that kind of thing. Starting to hit the RSV season, so we start seeing some of our little babies with that as well. Flu season as well is, of course, here. So
the sheer numbers point to the need for another pediatric emergency room that will be part of the new Kosser Children's Medical Center, Brownsboro, opening in May.
Yes, I'm very excited about the new center. It's an extension of what Kosser has already established in this community, in this region, as far as providing safe and quality care. It's going to be extended out to even a greater regional area, and we hope to provide that safe and effective care for those patients and those families out there too. And it is a very rare opportunity, and it's a very exciting opportunity.
It's a new service that the Limbergs say will make their lives much easier.
We're optimistic that in services and procedures like her G-tube replacement can be done close by, and procedures like that will be so much helpful to us to have that close by in case we need to go there. In addition, it isn't always 3 months. There's times when the tube could get plugged. So rather than packing up and heading to Kosser's, we'll have a place close by, which would be so much more convenient to us, and we're really excited to have that here.
We're really delighted about the new medical center being so close by for children. Since we visit so frequently, it's going to be great to have an ER right there, pediatric specialists in those difficult situations where we need to get somewhere quickly. It's peace of mind to us knowing that there's going to be a facility so close by.
Oh, it's such a relief to have a medical center that's close by. You know, there's things that cause worry to us that we're not sure of, and should we take her down to Kosser's, to have a place that's closer by because she's so complicated, a place that will be familiar with her, know her, have her records available is so much easier than with a typical child.
In the event Courtney has to be taken to the hospital downtown, there are state-of-the-art ambulances designed just for kids to get her there safely and comfortably.
This is one of our ambulances. We have 3 total. This one currently is configured for a neonatal transport. We do pediatrics also in here. We are also equipped to do twins if we should need to. Basically, we take this for most of our ground transports. We usually go 100 miles. If temperatures are bad, we could drive 4 hours in this also. We are capable of delivering oxygen and air, nitric oxide, and heliox also with this truck.
The KCMC, or Kosser Children's Medical Center, is a 24-hour emergency outpatient services building that's being built just outside of Brownsboro Road here in Louisville. And our goal is, should a patient need care that can only be administered at Coast Children's Hospital, this team and ambulances would transport that patient in a critical care environment back downtown where those services could be rendered.
We have established in this area a Just for Kids travel ambulance, and that ambulance is equipped to carry kids from neonate to, when they're just born, all the way up to young adults. And we are able to have one number that we call, and we can transport those children that might need extended or more critical care right down to here within very few minutes. That call goes out to, we just make one call, dispatch actually talks with the physicians, they know exactly what equipment they're going to need, and they start the run very quickly.
And that means peace of mind for the Limbergs, who know firsthand how important immediate and critical care can be.
Well, we're always optimistic, but we want to be realistically optimistic too and understand the challenges that we have in front of us. We see improvement every day through physical therapies and occupational therapies, and even working on her vision, we can see improvements. So we can't love her anymore. However, we take each day as a gift, and can't love upon her any more than we do.
Courtney has to have 24-hour nursing care. She is truly a precious jewel. Next.